So my name is Debbie Murray and I'm part of the transformation team in Naira Bevan University Health Board. We had a really good line manager who has left for better things, but she was a real inspiration for us because she had that strategic view. Back a year ago, she got us all our team onto the programme, the CAPE programme. And at the time, we were all unsure how this was going to work, but she had this vision of how it was going to be. And she said it was all about going from the linear approach to the circular economy approach. And then it all began, the programme. And what a programme, what a journey it has been. It has been absolutely amazing, and I would say absolutely life-changing for every one of us in our team. Because what we've learned is changed the way we work, it's changed the way we think, it's changed everything about what we do. And it's been such a journey. We've had highs, we've had lows, we've had confusion, we've had innovation, we've had everything on this journey. And that's why we're standing here today. So this is where our journey began. They asked us to put a project together, and we wanted to solve the world. We thought, right, NHS, we were going to do this now, we were going to sort out the employability. And what we wrote down was, we were going to grow and retain our own workforce collectively for existing staff and our local communities, so that we become the employer of choice, improving sustainability and continuity of care for our local population. Adopting a circular economy, we felt that we would be reducing unemployability, Pacific-based, place-based care, and improving health outcomes for the population. So that's how we started, if only we knew. And what happened then is that Katie and Jill, they took us through a process. Okay, that's a great project, but how are you going to do it? How can you achieve that? And that's what helped us then break it down into stages. So our vision is that within our team, we look at working collectively with health and social care. So although I'm NHS, we also work with local authorities about helping us to work more seamlessly across the border. So how could we work more collaboratively? How could we create opportunities for people, local careers for local people, and also using the circular economy principles? So we went on a few months of the programme, and in that programme we had parts that we did. We had things where we did the empathy, definition, ideation, all things that we have learned and carry on in our everyday lives. But one of the things that we did was we did an ideation workshop within an Naira Bevan. And what we did is we said, well, we've come so far in this process, but how can we now move forward? So we got people from all over the health board in a room, and we said, right, we need your help. And using the tools that we'd learned from CAPE, we then put it into practice. So we looked at brainstorming. We looked at, this exercise that we did, it blew us away, it really did. Because, you were given post-it notes and it was in silence, which is something we'd never done before. But the creativity that it gave was absolutely amazing. We looked at stakeholder bullseye with them all. We looked at the primary, the secondary and the tertiary. So how can they help us? What ideas? We had loads of ideas of what we thought, but was it in sync with everybody else within the health board? And this is what we came up with, because we did an assumption map. And we did, at the end of it then, we looked at our primary, our secondary and our tertiary, which gave us then our assumption map of where does it all sit. And this has really given us our drive. This has given us our template of moving forward, of having an idea, but putting it into practice. And this has then allowed us then to start coming down more and actually breaking down what we want to achieve. So we want to improve the potential health and social care workforce experience and employment opportunity pan-Gwent. But we're going to look at just doing it at the moment from a more selective people. So we were looking at retire and return, students, the local population and the workforce sustainability. So that we would have a streamlined process, sustainable workforce and less agency use. We then started to be able to bring all these ideas together, and this then has given us a roadmap of our success. So we look at the process, the skills, the knowledge, the milestones, the cost and the timeline. And this is what gave us then our information to actually go forward. So where are we now? Bear with me now, this is where my colleague should be standing in for me now. So let me just get my notes. So where are we now? Well, we are currently focusing on all the recruitment options in an Iron Bevan in order to improve the current processes and collaborative with social care to create a sustainability through partnership working. And our successes to date is that we've put together an employability paper that allowed us to look at all the issues that we were facing and actually highlight the current issues. We developed an action plan to take in the improvements forward, but also we've got collaboration with the health and social care. And if you can see on there, we've got a bus that's going around for this for the next 5 months, and it's going around local areas, strategic places, and we are working with them to try and bring in the local community, to try and bring in people that want jobs within health and social care. So how do we intend to move forward? So that's quite a lot on that screen, so I'll summarise it really, because we plan to create a tailored, flexible and person-centred support for people who want help to find work and stay in work, creating a sustainable workforce. And we intend to do that by looking at our stakeholder feedback so we can improve our processes and our performance. We're going to create a joint integrated health and social care recruitment and retention process, create a digital platform which includes better use of social media, create a consortium to support and innovate recruitment, training and development, and the one thing that we're working on most of all is one point of access for both internal and external applicants across the sectors. So the health and social care sector will benefit from this approach as it will focus on 3 fundamental principles of CAKE for us. Sustainability, less paperwork and reduce our carbon footprint, resilience, strengthening the communities, and inclusiveness. The right person at the right time in the right place. Thank you very much.